Have you ever thought about addiction? As you're probably aware, prescription painkillers are very addictive. Even though supervised use of prescription painkillers can lead people away from addiction, teens and adults should not have prolonged use of prescription painkillers. Today I'll talk to you about the dangers of prolonged use, the causes of prescribed drug abuse, why it's so easy to misuse drugs, and the road to recovery. Did you know that prescription painkillers work to alter the mind and not to heal pain? Altering the brain can cause a euphoric state of mind, which can cause an addiction. An addiction is difficult to understand for doctors, even let alone patients. An addiction is an illness. It's not a choice, and it cannot just be turned off. Addiction and physical dependence are not the same thing. Addiction happens when the brain needs the substance to essentially feel and function normally. After the brain and body decide that they need the opioid to feel normal, people will start taking the pills in ways other than what is recommended. The causes of prescribed drug abuse stem from a mental dependency or a physical dependency. A dependency forms when your body and brain get used to the drug that helps to relieve the pain. Mental dependency comes from a compulsive or chronic need, and physical dependency comes from the adaptation to a substance which the abstinence produces withdrawals. Physically dependent can be without an addiction. An addiction usually stems from a mental dependency. Dependency causes people to do things that they would not normally do to get the substance that they need. Doctor shopping is one of the things. People can go to many different cities and even states just to get the substance that they need. They'll even spend multiple paychecks on just getting a pill. Doctors can only do so much to prevent the misuse of prescription painkillers. They can warn patients of the side effects and direct them on how to properly use the drug, but they can only do that. Doctors can't necessarily follow the patients home and make sure that they do everything properly to a T. The main things doctors usually say is don't use them with alcohol, don't share them, and only take as many as recommended. Teens are more susceptible to peer pressure during their adolescent stage because their friends will say things like, oh, they're my mom's, it's fine, or they came from a doctor, so they're safe. Parents need to monitor the pills or just hide them. Teens overdose, and parents will usually find fault on the doctor. And some people believe that they shouldn't be prescribed to minors because they are so addictive, even though that's the only thing that could help them. You may not always be able to prevent the misuse of prescription painkillers, which can lead to an addiction, but luckily there are ways to recover from that illness. The 5 emotional stages you'll go through in admitting to having a problem would be denial, anger, bargaining, depression, and acceptance. Denial can prevent people from seeing that they even have a problem, and then it prevents your friends and family from also noticing that there is a problem. Anger happens when friends or family try to help the person before they're ready to admit that they have a problem. Bargaining happens when people begin looking for ways to take the pills without it looking like it's harming them, like changing the times that they take the pills every day. Depression comes next when they start to give up the substance. They have thoughts to if life will be worth living after the substance is out of their life, and then withdrawals commonly happen with depression. Acceptance comes when a person has admitted to being addicted, and they are open and honest, and they are ready to begin the steps to recovery. The first step to recovery is dealing with the problem and going to therapy. The second step is remembering and recalling experiences. Narcotics Anonymous would be where they describe where they were in life and why they started and how they got to where they are now. The third step would be reconnecting with people and activities that they may have let go of when they got wrapped up in the addiction. The fourth step would be relapse prevention, to create a future path to stay sober from the drug. And the fifth step would be to remain sober. The makers of prescription painkillers did not intend for them to be so addicting, but there are always faults in honest intentions. They are made to help, and the dangers in prolonged use for many different causes and many different reasons, and there are always a way to recover. Just keep in mind that when you're faced with an addiction, you're not alone, and there are ways to recover from it.
Yay! Good job.
Now she's got to film the crowd.
Yeah.
So she's